is Joseph Nani. I'm a home health nurse today, and we will be going over a home safety check for a patient's place of residence. So the purpose of this video is to go over fall risk assessment. So what that means is essentially if a patient's coming home from discharge, if they're mobility impaired, if they have weakness in the limbs, they'll have issues walking, right? So what we want to do is we want to be able to reduce and prevent the risk of falling through just moving things around to make things easier for these type of patients that have mobility issues to get around the house, especially go to the restroom, do their ADL, stuff like that. This first thing I want to point out is this ottoman here. So furniture needs to be put against the wall. Um, we want to create a clear pathway to different rooms, especially the restroom for our mobility impaired patients. So this would be pushed towards the wall so people wouldn't be able to bump into it, say for example, or we want to create enough space, for example, if someone was in a wheelchair or someone used a walker, we don't want them to kind of navigate. We want it to be straight. So this would be pushed towards the wall. Another thing here is the fan here. So this fan needs to be not in the middle of the room. It needs to be put near on the edge of the room on the side. So it would also go in the corner here. Another big thing with this fan is the cord needs to be put in a place where people can't slip on it. So what that means is it's not in the pathway, and we don't want people to be able to do this with the cord. So there's a lot of people who are mobility impaired. They will either use a walker or they would use a shuffle gait so they won't have their feet lift up. So we want to be able, so for example, if this was plugged in, we don't want people to slip, trip, and fall on it, so this would be near the wall. If we go over here, so for example, this wheelchair, this is also in the middle of the way, people can bump into it. Assistive devices should be near the patient so they can go into different rooms, especially if, say, for example, they're on a bed or a sofa. You want to have it nearby. You can help them out if you need to. But you just want to be able to give them the access to their assistive devices if they're able to. They just need it to ambulate somewhere else, to either go to another room, go to the kitchen, go to the bathroom, wherever it is they need to go. The other thing here is this rug. So this rug is kind of the same issue as the electrical cable or like the cords. So this is another thing where if you put your foot here, especially if people have shuffle gait, they can slip, trip, and fall, and then they can have an injury and then end up in the hospital again. We don't want that. So what the CDC recommends for these are either we take out these rugs or we double side tape them. So essentially we tape them down so people can't get their walkers or get their feet underneath here. Another quick things to point out are some of these items that are strewn across. So these items need to be put and organized up and not for someone to come over and trip over. So this is another thing that we need to be mindful of. This table here is also another example of kind of like not clearing the pathway. It's also furniture. Especially say for example if a patient wants to sit on the sofa, they need space for their assistive devices, or they need space to pivot around and do all those things. And a couple last things here. This tile here for this part of the room, we want to make sure it's anti-slip, and we want to make sure that it's not wet. Patient would have house shoes or like grippy socks to make sure they don't slip, trip, and fall on this surface that has less friction. And lastly, we want to kind of go over the lighting. So lighting is very important for older patients because if older patients tend to have a bit worse vision just because of age, Sometimes they have other issues like diabetes or visually impairment. When you get older with age, you have, less, eyesight, I guess. Like, far eyesight. So that's another thing that needs to be, especially, you want your patients to be able to see where they're going, and you want them to be able to see where their feet are going. So by having great lighting, especially in like bedrooms, bathrooms, and even like the living room like this, they want to have good lighting. So with that, I think that's about it I wanted to cover. Thank you for watching, and hope you have a good day.